Hello and welcome to the Let's Talk About podcast, a series brought to you by Tallaght University Hospital with the support of the Adelaide Health Foundation. In this 6-part series, we're going to cover safer mobility and the various things that can affect our mobility as we age. In this first podcast series, let's talk about safer mobility and falls. Falls are a significant worry for older people. 1 in 3 people over the age of 65 will have a fall each year, and the risk increases with age. Over the course of the 6 episodes, I will speak with a number of colleagues at TUH who are experts in this area. We will talk about how we can improve mobility as we age, and how to reduce falls and injuries from falls, and if someone does fall, what we can do to help them. We hope this Let's Talk About podcast series will help older people, those who care for older people, and healthcare professionals develop a better understanding of falls prevention so people can stay active, keep moving, and enjoy life with confidence. Hello, my name is Paul McElwaine and I'm a consultant geriatrician working in Tallaght University Hospital, and welcome to the 5th episode of the Let's Talk About Safer Mobility podcast. I'm delighted to be joined by Louise Kelly, a clinical nurse specialist, and Victoria Doyle, a clinical nurse manager for Continence Care.
Hello, Paul.
Hello, Paul.
Today we will discuss 2 common problems and how they can lead to falls. And I believe we will show how the 2 problems often can coexist and lead to a catch-22 dilemma in trying to improve them. So before we start the discussion, I want the listeners to imagine that you get the sudden urge to go to the toilet, and you know time is an issue, but you also know that every time you get out of your chair, you feel muzzy and think you might fall. So what do you do? So with that conundrum posed, Louise, perhaps you can start by explaining a condition known as orthostatic hypotension, and what it is and how does it affect people?
Well, the easiest way to explain orthostatic hypertension is when your blood pressure drops suddenly. This causes a reduced blood supply to your brain. It most commonly occurs when you change positions. So by that I mean moving from lying down to sitting up, sitting to standing, or even bending over to tie your shoes or put on your socks. It affects people in different ways as well. So you might feel lightheaded when you change positions. So as I said, standing up, or you could experience blurry vision or feeling unsteady when you're out walking, feeling weak, or even having more falls. These are all signs of orthostatic hypertension. And if you do experience any of these signs and symptoms, you should speak to your GP, your practice nurse, or your healthcare provider and tell them about that you're concerned by your symptoms.
Okay. So this condition, what causes it and what can we do about it?
So our blood pressure changes throughout the day, and there's lots of reasons why it might suddenly drop. So dehydration is one of those reasons, so not drinking enough of the right fluids during the day. Increased age, so as we get older, it's more common as well. After eating, so especially after large meals. Being in a warm environment, so during the summer months or if we turn the heating up. And an effect, it can be as a side effect of certain medications. Even the time of day can affect our blood pressure. So there are some things we can do to combat it. So mainly lifestyle changes that you can make to ease your symptoms. Drinking plenty. This is very specific to each person and their medical background. So any changes you do take to your fluid intake need to be discussed with your GP or your healthcare provider. So it's also really important to take your medicines at the time they're prescribed. So as they're prescribed, so if they're supposed to be taken in the morning, to take them then. Try avoid sitting or standing for long periods of time. So queuing in the bank, in the post office, in the supermarket. One of the perks of getting older is that occasionally you're allowed to skip those queues. So if the opportunity presents, you should. If that doesn't happen, there's things you can do to combat. So clenching and unclenching your calves or buttocks muscles, or gently rocking back and forth on the balls of your feet can help increase your blood flow and prevent your symptoms. Also, if you can try to avoid bending down suddenly, using long-handled aids if you do need to get something off the floor, or to get down to the floor in stages so it's not a sudden movement. If you've experienced any of the symptoms I've mentioned, so try and sit or lie down as soon as it starts. So if you can lie down, get yourself into a position, have the feet up higher than your head. So be that with a few cushions or the edge of the sofa under your feet. If you can't lie down, sit down. And if you can't sit down, if you're out and about, prop yourself against the wall and call and ask somebody for help.
Okay. So Louise has spoken about the importance of drinking plenty of water in the right circumstances, but that may be a real challenge for people with continence difficulties. So Victoria, how common is incontinence, and is it a major cause of falls?
Yeah, that's a really good question. And on both, incontinence is really common, far more common than people think. It is highly underreported. So we don't have definitive statistics, but if we did, it would be a huge number. There was a recent research done, and it comes in at, for adult age group, 1 in 7 people. But as we get older, that can come down as little as 1 in 3 people. So that's fairly significant, in our population. It is also a second to dementia for the reason for people being admitted to a long-term care setting. So it's really common. It's so common, but it is so underreported, and people they don't talk about it. It's got a stigma around it. It's taboo. People are embarrassed. We need to stop. We need to stop that and start talking about it. I mean, and in relation to falls, it's actually quite a common theme when people are admitted into the hospital following a fall. When we get down to talking to them, people are usually on the way to the bathroom, rushing to get to the toilet, or with the urge to go to the toilet, falling, going through the door, off the toilet pot, getting up from the toilet, things like that. It's continence with falls is a huge impact. A huge impact.
I think we're very familiar with that in the hospital setting, certainly,
Yes.
But I'm sure it also applies at home from that
Yes,
rushing element. So what advice do you give people to help them improve their continence?
For people to start thinking about incontinence, once you have registered with yourself that you are incontinent, incontinence can be as little as a leak or a major leak, So, once you establish that in your head, there's lots of different lifestyle factors you can start with. We would start conservatively managing people before we rush to surgery or we rush to medicate people. We would ask people to make certain changes in their lifestyle. We'd start with looking at kind of your diet and your hydration. So this thing of having to drink 2 to 3 litres of water, it's not for everybody. It's not, for some people, yes, it is because they're exercising or things like that. But if you're not, using all the water, you don't need to drink 2 or 3 litres of water. So it's worth thinking about that. It's also drinking our cups of tea, all our lovely cups of tea and coffee that we all love so much. You need to factor all of those into your fluid intake. If you have a high alcohol intake, we would ask that you reduce that as well. Lots of fizzy drinks. We're big fans of fizzy drinks. And we ask this because they are irritants. The caffeine, the tea, coffee, the fizzy drinks, the alcohol, they're all highly irritant to your bladder. So that is why we would say cut them down. Drink a glass of water instead. Cut 1 or 2 cups of coffee to a decaf option, things like that. And that's why we would ask that part of it for the drinks rather than the amount you're taking in. We'd also kind of recommend weight loss if you are overweight, because this puts pressure on your bladder and bowel. So to try and lose some weight off that, to take some, pressure off those would be a good start as well. And we also would ask about the pelvic floor, and we would recommend good pelvic floor exercises. People think this tends to be for women. It's for men also. Everybody has a pelvic floor, and we need to look after them. They say, if it's weak, you will leak. If it's strong, you will hold on. So the pelvic floor really is just a group of muscles that holds up your bladder, bowel, and your womb. So if they're not strong, things start to drop down. Okay. So I would recommend a good pelvic floor exercise as well.
Okay, so maybe a question to both of you. This is clearly a specialist skill to assessing for these problems, but are there any tips you might offer to listeners if they are suffering from, say, starting with you, Victoria, continence issues?
Yes, a lot of people are nervous about that, suffer with incontinence, going out, socialising, and like incontinence has a huge impact on people's quality of life. So if you are suffering with any issues, and you want to go back out socialising, think about where you're going. Be familiar with your surroundings. If you're going to a relative's house, a pub or a restaurant, find out where the toilets are. Know your location. Have a look. Sit closer to it if you can. And if you are nervous about going out, make sure you're not wearing really tight trousers or something that you're going to struggle to get out of. Wear loose clothing. And, you know, have a little backup if that's what you need in your bag, you know, extra clothing, things like that. You know, we want people to start going back out. We don't want incontinence to keep people indoors. We want people back out. And after the last year or so, you know, we need to get back out. So know your locations.
I've heard a message about answering the call. Is that
Oh,
something?
yes, answering your call. So answering your call is when your brain gives your bladder or your bowel that little signal it wants to empty or to, you know, go to the toilet. So answer that call. Don't leave it too long. Leaving it too long leads to the rush, the panic. And that's, again, we see the falls happening through that when people, you know, leave, you know, don't answer that call.
Okay.
So answer it.
So Louise, same kind of question. Any tips that you would offer people who are suffering from the symptoms of low blood pressure, particularly when they stand up?
Yeah, so if you think you're experiencing some of the symptoms of orthostatic hypotension, your first port of call should really be the GP. They can have a look at the medicines you're currently on, and your pharmacist can actually do this too. They're a great resource for us all in the community. You yourself can make some lifestyle changes. So by eating smaller meals, being more aware of your symptoms, especially in warmer weather, or ensuring that you're staying much more hydrated.
Okay. Well, that was very, very helpful and practical advice. But if you had one take-home message, what would that be? I will start with Victoria.
Okay. Mine would be talk about it. Just get talking about it. You know, if there's plenty of help out there. If we don't know we need to help you, then we can't help you. So start off by talking. If you feel more comfortable talking to a family, friends, your neighbour, you know, speak about it. And you'll find that you're not alone. You'll find that when you start talking about it, people will also, oh, I have that. Oh, that's that. And you can help each other. But just talk. There's help. We can do it. We can help all together. We can help you.
So Louise, same question. What would your take-home message be?
Yeah, it would probably be to take your time. So take your time getting up from the chair, you're out of your bed, or even when you're in the toilet, take your time getting back up. And sit back down and wait if you do feel dizzy. Don't rush, get up in stages.
Okay. Well, thank you, Louise and Victoria, for talking with me today. Two really common problems that people should really talk about more. Join us next time for the 6th and final episode of the series of Let's Talk About podcast. We will be discussing the role of cognition in mobility and how conditions such as dementia can lead to falls, and also how a fear of falling is in itself a risk for falls. So a really important topic to close the series. Thanks for listening, and talk to you soon.